Hi, welcome in. Are you here for Botox today? Okay, let me just pull up. Have you been with us before, or is this your first time? First time? Okay, well, welcome in. I'm Dr. Starr. I'm going to be doing your Botox today. Let me just get some information from you. Can I start with your name? Okay. Email? And your current phone number. Okay. And then just the Botox. We're just doing the Botox today. Okay, cool. Yeah, we do have other services. Where did you find us? Through... Okay, just Google. Okay, yeah, on our website, it shows all the different services we have. We have dermaplaning, we have PRP, which is a blood platelet procedure that we do to help aid in hair growth, and some other stuff, some facials, stuff like that. Yeah. We've been here in this building for the last 2 years, I think. Before that, we were kind of across town somewhere, but yeah, we've been here. Well, it's good to have you. I hope you enjoy the results. Before we get started on anything, where are you looking to get your Botox today? And have you ever had Botox at all? No, okay. Okay. Yeah. Okay, let's see. Do you mind if I touch you? Okay. I do see a little bit in your forehead. Go ahead and scrunch for me and then raise your eyebrows. Yeah, I see we could get, like on me, you see right there and right there. Yeah, we could do that. And then let's see. You want your smile lines? Okay. Go ahead and smile for me. Okay, yeah. We can work on those. I do see they are there when you're not smiling. They're not too crazy, nothing too dramatic, but we can work on those, just smooth those out a little bit. Okay. Okay. So you've been experiencing some jaw pain. Okay, yes, we can do the masseter. That's less cosmetic, obviously, but it does have some results. You will notice a slimming in your jaw over time, just because that muscle is not working and building more muscle, right? So you want to do that as well today? Okay. Well, I'm going to put on some gloves and then feel your jaw and see what we can do. Do you mind if I just move some hair back? Okay. I'm just going to feel... Go ahead and clench your teeth for me. Okay. Do you notice you grind? Yeah, okay. That's usually why people get it, is they have what's called bruxism, which is a chronic grinding of the teeth. And sometimes it's not even grinding, sometimes it's more of just a bearing down. Yeah. Okay. We can definitely do that for you today. I will be right back. I have to grab something really quick. I'm gonna go ahead and mark and clean the areas that we're gonna work on today, okay? And those are the only ones you want, right? Okay. And actually, before I do that, I'm going to take your temperature really quick. Just have this. I'm going to do it on your forehead, okay? Okay. Very good. And I'm also going to check your breathing. This isn't a requirement, but I like to be thorough and make sure that there's nothing going on that we could cause even more trouble, right? Okay. So I'm just gonna have you breathe normally for me. Okay. Then on your back. Okay. Breathing sounds are normal. Okay, now that we did that, I can go ahead and clean the skin off. Make sure it is a sterile field for us. Okay, so I'm just going to clean your jaw on both sides. Okay, now get on your forehead. And on your smile lines. Go ahead and do that for me. Very good. Now we can go ahead and mark it. I like using this colorful marker. So I'm going to use the blue. This is safe for the skin. And it's also, you can wash it off when you get home, okay? Okay, so I'm going to mark, go ahead and scrunch for me. I'm going to mark right there. And right there. Okay. And then smile. Okay, very good. Mark right there. And then there. Okay, now let's do your jaw. Go ahead and clench your jaw for me. Okay, right there. And then right there. Okay. So we can get started now. So you haven't had Botox before. It's gonna feel like a sting and a little bit of a burn, but it's not going to, well, it shouldn't hurt too bad, okay? And you let me know if you need any breaks, okay? Okay. So this is what we're gonna be using, this syringe. I'm gonna take the top off and inject the Botox really quick. Okay. Very good. And we're gonna start from the top down, okay? So I'm gonna go to my marking and go ahead and take a deep breath in for me, sweetie. gonna go ahead and work that in with my gloves. How are you feeling about that? Okay. Yeah, just a little pick. We're not going too deep into the skin or anything like that, so. But again, just let me know if it's too much, okay? Okay. So let's do. There is a little bit of blood, so I'm just going to write that down. Okay. Okay, we're almost halfway done. We're just gonna do your smile lines now. Okay, so and one more pick on this side. Okay. Again, just a little bit of blood. Nothing too serious. And then, okay, we're more than halfway done now. How are you feeling? Okay? Okay. You're a champ. Especially for your first time, I'm going to, this area is gonna hurt a little bit more, okay? Because it is on the bone, okay? So I'm gonna be as gentle as possible. If you want, you can squeeze my arm. Yeah, no worries. Okay, I'm gonna tell you when. I want you to take a deep breath in for me, okay? And out. Almost out, almost out. Oh, okay. How was that? Yeah. Okay, we have one more. Do you want to take a little break? You want to just get it over with? I totally get it. Okay. I'm gonna do this really quickly then. Breathe in and out. Okay. You're all done. Yeah, just take a moment to breathe, and I'm just gonna go ahead and distribute that a little bit. Okay. How are you feeling? Some of that pain is starting to go away. Yeah, it should not last at all. You might have a little bit of soreness. Now let's talk really quick about aftercare, okay? So I don't want you to put anything on your face for the next at least 24 hours, okay? So tonight, avoid any kind of creams. If you're gonna take a shower, try to keep your face as dry as possible, okay? Okay. I'm gonna just take a couple notes. But overall, I think it's too soon to tell, but it should, everything looks good. It's in the right area, so that's a good sign. Do you want to go ahead and look in the mirror? Okay. Yeah, nothing too dramatic. Again, it's gonna have to settle, but you are all set. I'm gonna leave you here to kind of take a moment, and you're free to leave whenever. Well, I do have the patient coming in about 5 minutes, but until that point, you're free to leave whenever. And yeah, I hope you love the results. If you want, we can follow or schedule a follow-up, or we can wait and you can see how you're feeling about it, okay? Okay. Also, don't chew anything hard right now, okay? Okay, yeah, just give the jaw some time. Okay. Well, I hope you have a great rest of your day, okay? You're so welcome.